Dermatophytosis in shelter cats overview. Ringworm is a superficial fungal infection of the skin, hair, or claws caused by a dermatophyte. It is a veterinary concern because of the zoonotic potential to spread to humans. Ringworm is a very common outbreak in shelters, especially among cats, and this presentation will explain ringworm, how to prevent an outbreak, and how to treat. Objectives for this presentation include defining ringworm, how the disease presents itself in cats in a shelter environment, how we diagnose ringworm through clinical signs and physical exam, what is the proper notifications that must happen to contain an outbreak, housing requirements for those cats, infected versus non-infected cats, risk assessment of infected versus non-infected cats, sanitation protocols that go beyond just treating the infected cats but also the environment, treatment policies in shelters, these may vary, treatment to rid ringworm, recovery period, proper documentation required, and adoption potential for these cats. Ringworm is an infection of keratinized tissue, skin, hair, and claws. It is caused by 3 genera of fungi, with microsporum being the most common type seen in cats. It is clinically known to be a self-curing disease in healthy cats, with self-cure occurring within 4 months of infection. Recognition of the disease presents with circular alopecia and erythematous margin around central healing, the ringworm. Lesions are typically small with a 4 to 6 centimeter diameter and can appear at temples, pinnae, bridge of the nose, feet, and tail. If left untreated, all areas of the body can be affected with hair loss and crusted lesions. In most cats, this is a self-limiting disease with hair loss and scaling. If the cats are immunosuppressed, then the outcome may become a multifocal or generalized skin disease. Diagnosis. A Woods lamp examination with microscopic detection of the arthrospores on hairs is a simple way to confirm ringworm infection. Direct microscopic examination is also a simple method to detect dermatophytes. The gold standard for detection is to pluck some of the hairs and scales from affected areas and culture on Sabaran agar. DTM fungal cultures can also be used, and the collection of the affected hair and lesions are the same. Because microsporum is spread from contact with an infected animal or a contaminated environment, it is a very serious problem in an animal shelter. When a staff member or volunteer is educated what to look for when once they see some hair loss or a crusted lesion, the veterinarian or person in charge should be notified immediately. If there is no one in charge at the shelter, then a phone call should be placed to next in line when an emergency or something occurs that needs taken care of immediately. This cat or cats should be isolated and all staff members made aware of this potential outbreak. All shelter cats should have diagnostic samples collected that day to confirm the infection. Shelters have the responsibility to protect the staff, volunteers, and public from zoonotic diseases. Once a lesion is noticed, then it is given that it's ringworm until proven otherwise. There should be limited movement through the shelter, as many may lose hairs that fall from the potentially infected cats that can get into the environment and be taken to other areas of the shelter and infect other animals as well as humans. Once infected have been identified, all infected cats will be moved to isolation. Clearly identify suspect animals by posting a sign on their cage. It is important that all staff, volunteers, and employees are educated and wear the proper PPE, long sleeve gown, gloves, shoe covers, or boots when working with these infected animals. Daily, there should be thorough vacuuming and mechanical cleaning to remove infected material, visible hairs. All surfaces should be cleaned with a 1 to 33 lime sulfur ratio on the infected animal and a 1 to 10 to 1 to 100 household bleach for cages. Cages must be washed daily as well as toys. Any toys not able to be washed should be discarded. All surfaces should be cleaned 3 times with clean rags. Bleach, Axle can be used and is very effective on pre-cleaned surfaces. The Correct Shelter Medicine Program Environmental Cure, the 5Ds. Diagnose, recognize, and treat infected and carrier animals. No amount of cleaning or disinfection will work if one or more animals are recontaminating the environment. Remember to check other pets in a foster home, especially cats. Human lesions also need to be identified and treated. Discard. Heavily exposed items such as scratching posts that cannot be easily washed or disinfected should be discarded. Debulk. Careful mechanical cleaning goes a long way towards removing ringworm contamination. This includes clearing cluttered surfaces such or use of an electrostatic cleaning product such as a Swiffer to remove as much dust and hair as possible from every surface and vacuuming all of the accessible areas. Commercial steam cleaning of carpets may be helpful for both mechanical cleaning and heat destruction of spores. Where possible, furnace filters and air vents should be cleaned and or replaced. However, cleaning of ductwork is often not necessary. Disinfect. After removal of organic matter 3 times with a detergent and clean rag, use an effective disinfectant such as Axle 1:116, Axle TB hydrogen peroxide 0.5%, N-oconazole, bleach at 1:32 dilution, 2% potassium peroxymonosulfate formula 409, quaternary ammonium 0.3%, or Clorox cleanup sodium hypochlorite 1.84%. Document success through environmental culture. Cut Swiffer into small sections, wipe possibly contaminated surface until visibly dirty, press Swiffer repeatedly onto fungal culture plate, then culture as usual. Repeat the 5Ds as necessary until environmental cultures are negative. It is important that all staff, volunteers, and employees are educated and wear the proper PPE, long sleeve gown, gloves, shoe covers, or boots when working with these infected animals. Daily, there should be thorough cleaning and mechanical cleaning to remove infected material, visible hairs. All surfaces should be cleaned with a 1:33 lime-sulfur ratio on the infected animal and a 1:10 to 1:100 household bleach for cages. Cages must be washed daily as well as toys. Any toys not able to be washed should be discarded. All surfaces should be cleaned 3 times with clean rags. Bleach, Axle can be used and is very effective on pre-cleaned surfaces. Reducing environmental contamination is just as important as treatment directed towards recovery of affected animals. Depending on the shelter, it is looked at as recognize and euthanize. Unfortunately, some shelters do not have the facilities or finances to treat multiple cats infected with ringworm. This may also be the only way to control this during an outbreak. It is best to look at all options for the remainder of the animals at the shelter. How does this outbreak affect otherwise adoptable animals? Is there a generally good prognosis for complete resolution? What type of impediment to adoption after treatment? Treatment would include cage confinement, clipping of hair coat to minimize contamination and protect staff. Optimum treatment requires using a topical treatment and, if possible, a systemic agent. Most effective treatment is a combination of topical and systemic therapy. Effective topical agents include lime sulfur and miconazole shampoo used twice weekly. Intranasal is the preferred drug of choice orally and is associated with fewer side effects and exhibits antifungal activity for several weeks after discontinuation of therapy. Fungal vaccines have been shown to be effective. Correct Shelter Medicine Program, Environmental Cure, the 5Ds. Diagnose, recognize, and treat infected and carrier animals. No amount of cleaning or disinfection will work if one or more animals are recontaminating the environment. Remember to check other pets in a foster home, especially cats. Human lesions also need to be identified and treated. Discard. Heavily exposed items such as scratching posts that cannot be easily washed or disinfected should be discarded. Debulk. Careful mechanical cleaning goes a long way towards removing the ringworm contamination. This includes clearing cluttered surfaces, use of an electrostatic cleaning product such as a Swiffer to remove as much dust and hair as possible from every surface and vacuuming of all accessible areas. Commercial steam cleaning of carpets may be helpful for both mechanical cleaning and heat destruction of spores. Where possible, furnace filters and air vents should be cleaned and or replaced. However, cleaning of ductwork is often not necessary. Disinfect. After removal of organic matter 3 times with a detergent and clean rag, use an effective disinfectant such as Axle 1:116, Axle TB hydrogen peroxide 0.5%, N-oconazole, bleach at 1:32 dilution, 2% potassium peroxymonosulfate formula 409, quaternary ammonium 0.3%, or Clorox cleanup, sodium hypochlorite 1.84%. Document success through environmental culture. Cut Swifter into small sections, wipe possibly contaminated surfaces until visibly dirty. Press Swiffer repeatedly onto fungal culture plate, then culture as usual. Repeat the 5 Ds as necessary until environmental cultures are negative. The disease is more common in young, old, or debilitated animals because their immune systems may be compromised. We also look at the grooming habits of the cats, the overall cleanliness of the environment where the cats are housed. Cats are fomite carriers and usually lesion-free and Woods lamp negative. They may have some spores on their coats that could have been removed during grooming. As a safeguard, these cats would be cultured and treated with an application of lime sulfur. A simple infection consists of confirmed infections and are otherwise healthy. Complicated infection involves those cats that have long matted coats, other illnesses such as respiratory infections, or otherwise immunocompromised. This group unlikely may not be treated. Most cats will recover within 3 months. Treatment failure is evident in many shelters due to variables working within the shelter's limitations to isolate and clean the environment properly to eradicate totally. Topical treatment and systemic treatment are important in the recovery of cats in a shelter environment. Because of cost to treat and possible side effects, most shelters will treat with topical. Verifying a cure is important, and each cat should test negative 3 times in a row to feel safe that the ringworm has been treated successfully. Adoptions of cats will vary from shelter to shelter as the rate of turnover and live release also vary. Shelters will need to answer some questions to determine how adoption may continue during an outbreak. Number 1, how does the flow of animals in and out of the shelter affect the response plan to the outbreak? Number 2, is a plan in place that will keep incoming animals safe from exposure? Number 3, how is this going to affect the other needs of animals requiring sheltering? Number 4, can animals be safely sent into the community by foster care transfer or adoption, as this is zoonotic to humans? Number 5, how long can the shelter hold and treat these animals? What is the cost? Number 6, if the decision is made to not treat a group of cats, then a plan is needed for these animals if euthanasia is not an option. Documentation is vital in eradicating the outbreak. The documentation can take as little as 6 to 8 weeks and up to 3 to 4 months. The following documentation is required as part of this process for a successful outcome. Number 1, date of intake. Important so that it is known how many cats are brought into the shelter that day, who the cats came in with, where did they go on intake. Number 2, signalment. Species, breed, age, and sex. Also, long or short hair as the type of hair coat can determine if treatment is possible in the given shelter. Number 3, day lesions were noted and where. When were these lesions noted and where were they seen? Number 4, physical exam given upon noting the lesions. Number 5, clinical signs noted. Number 6, test results ongoing. These are ongoing throughout the treatment and recovery periods. Number 7, treatment plan ongoing. This is ongoing until the cats have tested negative 3 times in a row. Number 8, procedure for cleaning environment. How the environment was treated each day, how many times, what was used, who treated. Number 9, adoption. How many were recovered and available for adoption. Number 10, adoption education for owners. Education is the key. Thank you. I hope this has given important information in preventing and treating ringworm in cats in the shelter environment.